At the al-Zatari refugee camp in Jordan, Tarif Bakdash heals the wounds of war. Many are visible, others are buried deep in a person's soul. In March, the Syrian-born pediatric neurologist, who is a member of the Syrian-American Medical Society, led a group of Milwaukee area healthcare providers to Jordan. Their goal for that week was to improve the lives of some of the 80,000 Syrians in the camp who fled their nation's civil war that has claimed 500,000 lives.
I didn't know the team well, actually, who came with us. I just gave one talk, and then people started talking to me, well, we want to come with you. It just happened. People I never met before. And what's fascinating about this is that here are people from different places, different backgrounds. They're all Americans. They have no Syrian background like I do. And they decided to take time off, to pay their own ticket, to pay for their own hotels, to pay for the transportations, and to spend 1 week and give that week and dedicate that week to helping people that they never met. And we have people who are Jewish, Christians, non-believers, Muslims, all came together and all worked together. And it was an amazing experience, actually. And when you talk to these people, all of them, they all had a great time. They keep telling me, when is the next time we're going to go to al-Zatari? So, hopefully we'll have another one. Okay. So, for example, let's take Fred. Fred is an internist who, saw patients like almost throughout the day. His clinic was far busier than mine, for example. We have Tom Chalimsky, who's an adult neurologist. He had far more patients than I had to see. We had, Stacy, who was helping with psychological issues. We had nurses that helped in the emergency room. And people were waiting to see them, and people wanted to see them, actually. And they will tell me, where are the American, healthcare providers? They were asking for the American healthcare providers because people trust the American healthcare system. So you can imagine that beautiful impact when you have American teams coming down all the way 6,000 miles to spend time with these needy people and then to realize that they're all human beings. That is, again, one of the antidotes to ISIS. That's another message to say, no, we refuse violence and we're going to show compassion and love. And that's what the team did.
A major challenge for healthcare workers is not to be overwhelmed by the vast number of people needing help.
The key thing is to focus on one person at a time. You cannot just look at the whole problem and say, how can I help 80,000 people? Because that will really get you kind of crumbling and you can't do much. You need to really focus on each person and to say to yourself, I've helped one person, that's great. That's a good start, that's wonderful. I made a difference hopefully in that person's life, and that person will make a difference in your own life.
فهم المشاري والترمي على ليش بصير لي شيء بنذبح بعض.
We had this gentleman, he was around, I think, 39ish, 30, maybe 40 years of age, who came actually towards the end of my clinic, and he was asking to help him, financially. And I'm like, oh, sure, I'll be happy to help you. And then as I, tried to help him, and he started crying. And then I sat him down, started talking, why are you crying? And then he said, I was tortured by the Syrian government for 7 months. And he was crying through the whole process. And so I was very lucky to have Stacy, who's, an expert in, psych issues as a social worker. So she came in the room, and I was trying to help to, translate. And we spent, I think, more than an hour and a half with him trying to help him. Of course, you can't help someone with one session. These cases need far more help than just one session. So that's where I think we need, again, more help from everybody. Psychosocial issues are extremely important, I think. And the future of this nation will depend heavily on how we help, people when they have these psychological damages. That will affect them for the rest of their lives. And these are things that you may not see. We deal with acute things. We deal with amputations, we deal with, bullets and shrapnels, but we forget about the psychological damage of this war that's probably affecting millions and millions of people.
The happiness shown by refugee children might be a facade hiding emotional turmoil.
For example, kids that have psychological damage in war will show PTSD, post-traumatic stress disorder. They'll have anxiety, so they'll have fears, unrealistic fears. And of course, when you hear the stories about these kids, like their fathers have been killed, they're living with 6 or 7 siblings in a small area, they can't go back home. And a lot of kids, when you ask them, what do you want? The first thing they might say to you, I want to go home. So obviously just being away from home also is a major trauma to them. And I think kids tend to have more resilience in general, I think, compared to adults. But then the question is, do we know how much they're suffering inside? What's happening inside them? I don't know. We don't know, I think. They might be laughing and smiling, but sometimes you catch them at certain points. You can see how sad they are. And you can see aggression also in some of these kids. And that goes back again to the whole environment they're living in. So they are resilient, but I have no idea what the future will be for them. It's easy for us probably to say, you know what, hey, that's not my problem. I'm living in the United States. I'm too far from that. I'm not going to worry about this. But then if you think about it a different way and say, well, this is a human being. This could be my kid. This could be my son. This could be my daughter. How would I like it if somebody else, somewhere else in another world says, I don't care. It's not my problem. We all need to work together. We cannot afford anymore, actually, not to help each other. This is why actually the radicals are doing all what they're doing, because we're not working together on helping each other. And these poor kids need help right now. You can't wait. We can't say, well, it's not my problem. Well, guess what? This poor kid needs help right now. We can't wait to give him a visa after 6 years. The bottom line, you didn't choose to be American. I didn't choose to be American Syrian. He didn't choose to be Christian, Jews, or Muslims. We don't choose these things usually. Once we let go of these things, we can see the essence, which is humanity. We're simply human beings.